What to expect during a neurological examination. Imagine a healthcare professional carefully checking how well your nervous system is functioning. That's what a neurological examination is all about. It's a detailed process that helps doctors understand how your brain, spinal cord, and nerves are working together. This exam is especially important when doctors are trying to figure out if a brain tumor or other neurological condition might be affecting your health. First, the doctor will start by asking about your symptoms and medical history. They want to know what you're experiencing, how long it's been happening, and if there's any family history of neurological issues. This helps them focus on specific areas during the exam. Next, they will assess your mental status. This involves simple questions to check your thinking skills, memory, language abilities, and awareness of your surroundings. For example, they might ask you to remember a few words or tell the current date. This part helps identify if there are any cognitive problems that could be linked to brain issues. Then the doctor will test your cranial nerves. These are the 12 nerves that control functions like vision, eye movements, facial muscles, hearing, swallowing, and speech. They might shine a light into your eyes to see how your pupils respond, ask you to move your eyes in different directions, or check your facial symmetry and hearing ability. The next step is examining your motor functions. The doctor will evaluate your muscle strength, tone, and coordination. They might ask you to squeeze their fingers, lift your arms and legs, or perform movements like touching your nose with your finger. They will look for signs of weakness, tremors, or involuntary movements that could suggest issues in the brain or spinal cord. Sensory testing is also part of the exam. The doctor will check how well you can feel touch, pain, temperature, vibration, and your sense of position. They might lightly touch your skin or ask you to identify sensations with your eyes closed. This helps determine if sensory pathways are intact. Reflex testing is another key component. Using a small rubber hammer, the doctor taps on tendons like your knee or elbow to see if your reflexes are normal. Abnormal reflexes can point to nerve or brain problems. Balance and coordination are tested through simple tasks. You might be asked to walk heel to toe, stand with your eyes closed to test your balance, or perform quick movements like touching your nose or heel to shin. These tests help reveal issues with the cerebellum or sensory pathways. Throughout the exam, the doctor also observes your speech, facial expressions, eye blinking, and any involuntary movements. These observations can provide clues about neurological health. If the exam uncovers any abnormalities, your doctor may recommend further tests like magnetic resonance imaging or computed tomography scans. These imaging techniques help visualize the brain and identify tumors or other issues. Sometimes, a biopsy might be needed to confirm a diagnosis. In the context of brain health and tumor diagnosis, this examination is vital. It helps localize affected areas of the brain and assess how a tumor might be impacting your neurological functions. This information guides the next steps in diagnosis and treatment planning, ensuring personalized care. Remember, a neurological exam is a safe, non-invasive process that provides essential insights into your nervous system. It's usually performed by a neurologist, neurosurgeon, or trained healthcare professional. If you're experiencing symptoms or have concerns about your brain health, consulting a healthcare provider is the best way to get personalized advice and appropriate testing.